Good afternoon, everybody, and greetings yet again from Lichfield. And if you think it's hot here, we had to cancel talks in Samuel Johnson because it was too hot to actually go into the room that we normally use. So it's much nicer here. I think I might stay. So if you can't hear me, then please let me know, just raise your hand, because it's no good telling me at the end. And it's very difficult for me because I can hear sort of projectors and everything else, so I don't know how loud I am at the back. I have got a secret shopper there, so hopefully he won't fall asleep and he'll wave at me and let me know. So if you see a man raising fingers at me, please don't take offence. Right, medicine in the 18th century, the good, the bad and the deadly. Well, I'm sure you can understand that probably you'd be happier seeing a doctor today than you would then. I know it's difficult to see them sometimes, but honestly, some of the other ones you really didn't want to meet. Medicine in the 18th century suffered from a lack of understanding of anatomy and physiology. And an awful lot of it was based on what had gone before. Now, the Greeks and the Romans were very popular, but they hadn't done anatomy of people. They studied comparative anatomy, which meant, for example, that they would look at a cow. And I'm sure that lots of us know that a cow has more than one stomach. And although sometimes after Christmas lunch you may feel that you've got 4, I don't think you have. So you can see that there were going to be difficulties. Now, I would like to set the scene by reading an article from a gentleman who has written a book. And Thomas Morris has written this bit so beautifully, I'm going to read it. A very good stocking filler. It's full of little strange curiosities about medicine. So if anybody wants to come up later and take a picture, please do. So thank you, Mr. Morris. One summer evening in 1702, the Earl of Kent was enjoying a game of bowls in Tunbridge Wells when he fell down unconscious. Luckily, a prominent London physician, Charles Goodall, was nearby and arrived on the scene within a few minutes. He found the Earl lying on the ground, apparently dead, having neither pulse nor breath, 1 or 2 small rattles in the throat, his eyes being closed. The signs were ominous, but the doctor left nothing to chance in his efforts to save his patient. First, he bled the Earl, removing slightly more than half a pint of blood from his arm. Then snuff was poked up his nostrils, and antimonial wine, a toxic brew intended to provoke vomiting, was poured down his throat. The doctor's plan, orthodox for the time, was to shock the Earl back to life by provoking an extreme reaction, sneezing, coughing, or vomiting. These measures were unsuccessful. So the unfortunate patient was carried indoors, and yet more blood was taken from him. Next, his head was shaved, and a blister, a plaster smeared with a harsh caustic substance, was placed on top of it. The idea was that this would provoke blistering, and so force any toxins out of the Earl's body. Next, the resourceful medic administered several spoonfuls of buckthorn syrup, intended to empty the bowels. So you go in each which way. By this point, word had got around, and a number of other doctors appeared in the room, so that's very much like a modern ER. One of them suggested that it was time to try something more extreme. So a frying pan was sent for, heated in the fire, and then applied red hot to the Earl's head. This did not provoke the slightest reaction, leading several of those present to conclude that their patient was already dead. But Dr. Goodall was still not ready to give up. At the request of the Earl's daughter, the Earl's unconscious body was taken into his own chamber and tucked up in a warm bed. The doctors then ordered that tobacco smoke should be blown into his anus. This may sound an eccentric thing to do, but the technique known as Dutch fumigation was generally regarded as the most effective means of emergency resuscitation. This time, however, it was of no use. The doctors, realising their task was probably hopeless, tried one last thing. The bowels of a freshly killed sheep were wrapped around the Earl's abdomen, a desperate and thoroughly unpleasant attempt to warm him up. All proved unavailing, and the doctors finally admitted defeat. You wouldn't want to be resuscitated in the 18th century, would you? If you weren't dead before they started, you'd be dead at the end. No two ways about it. Now, the Dutch fumigation, for people who live in London, is an interesting one, because there was, in Victorian times, a Society for the Preservation of Life. And all along the Thames, there were posts where they had resuscitation kits, so that you could be pulled out of the Thames if they saw you go in and administer Dutch fumigation. And it was an idea that came from the native peoples of North America. So it was a slightly different peace pipe that they were smoking when they administered this. And of course, people couldn't really easily tell when somebody was dead because we didn't have stethoscopes. We couldn't take somebody's blood pressure reading. So things that we do today automatically were not possible then. And who am I to point the finger? Because in my romantic youth, I was a student nurse. And in those days, if you had an ulcer, a peptic ulcer, you were treated with a bland diet. And now we know that we should be looking at an infection and we treat it with antibiotics. So all those people who weren't allowed curry and the like, and it was irrelevant. Also, a lot of people in this room might be familiar with cholesterol, the word cholesterol. And we know that now that your own body makes about 80% of your cholesterol. But 50 years ago, we thought that it was what people were ingesting, and so people weren't allowed to eat shellfish and eggs and the like. They were banned. So that has moved on. And I know I am very old, but I would like to stress that it was at the beginning of my career that I actually worked with the doctor who administered the first ever penicillin injection. And he was lovely. He was the television doctor, Charles Fletcher. And that was a really mind-blowing series. People actually committed suicide because they have no idea about what surgery was like. How we have moved on. We watch all these programs on television. We are so au fait with our bodies now. But there is still a lot to learn. And in 50 years' time, we'll be looking back, well, I won't, but other people will be looking back and thinking, wow, why didn't they know that? So, you've heard the words Erasmus Darwin mentioned, and I suddenly realised I haven't got him. And this is a picture which I'll pass round of said Erasmus, who was a doctor in Lichfield. And this is his house, which is a museum that I volunteer at. Now, he was slightly younger than Samuel Johnson. Samuel Johnson went to London But they both had an interest in medicine, as you will see by going round this museum. Samuel Johnson was interested as a layman in medicine. Erasmus Darwin left a lot of correspondence. There was a commonplace book, and a famous poetess, Anna Seward, the Swan of Lichfield, wrote about him. So we know an awful lot about his medical practice. Now, his medical practice, he arrived in Lichfield in 1756. Had things moved on? No, they hadn't. So Erasmus Darwin was still practicing contemporary medicine, which involved taking blood, using plasters, those blistering things, purging. He loved purging. And sadly, one of the things they used was calomel, which actually was full of mercury. So not only was repeated purging not a really good thing for the system, but they would be putting mercury into you, which is definitely not a very good thing for your system. And he arrived at Lichfield, and he was very lucky because he became a famous doctor. His fortune was made, his reputation was made, because every other doctor had tried to save a young man, and they couldn't. But Mr. Ing was saved after Erasmus Darwin visited. And so word spread that he was this miraculous doctor. Now, Voltaire said, "The art of medicine consists of amusing the patient, while nature cures the disease." And I do wonder with Mr. Ing whether or not he was just very lucky at the time that he arrived. So Erasmus was very topical. He used all the remedies that were very current, and one of them that he used a lot was laudanum. And unfortunately, his young wife, Polly, died at the age of 30. She had some problems, we think, with her gallbladder system, and she was in excruciating pain. And her son said that her father had killed her with opium, and she had killed herself with brandy. Because, of course, laudanum is a mixture in the 18th century of alcohol and opium. And depending on how much of each you put in, is up to personal taste. Sale of opium, totally unrestricted. And they didn't understand the nature of opium, how it worked, what it did. But there was a very interesting plea from the Foundling Hospital to the College of Physicians saying, could they undertake some research? Because they had noticed that the babies who were being given Godfrey's cordial, which was a mixture of opium, water and treacle to quieten them, seemed to be quiet for a very long time. And the infant mortality rate in the Foundling Hospital was definitely affected by the use of this cordial that was probably in every household in the country. It was used for teething, it was used for infection, it was used for absolutely everything. Now, Erasmus Darwin not only helped the death of his wife, although poor Polly would have died anyway, but also he was very much integrated with the Wedgwood family. And his son, Robert, married one of Josiah Wedgwood's daughters. And Robert, his son, was called Charles Darwin. So Charles Darwin as in evolution. Now, unfortunately, her brother had lots of health issues, and Erasmus introduced him to increasing doses of opium. His friend had introduced him to opium to start off with. So when poor Thomas died, I think it was a bit rich.
Was it switched on?
It will be in a second. Yeah, we switched off, didn't we? he actually was very interested in photography. Doesn't this look like a photograph? And his death was lamented because he was making so many advances in photography. But in fact, this is, I think it's charcoal or pencil this was done in. And he died at the age of 34 because Erasmus, for this vague complaint he had, kept increasing his opium. And the friend who'd introduced it to him was horrified. But pot, kettle, black, his name was Samuel Taylor Coleridge, which, because I know the audience I'm talking to, I know you'll know who I'm on about. You say sometimes, in Staffordshire, you say Wedgwood, and you go, no, Wedgwood? Such a big industry in Staffordshire, or it was, and now we have a whole generation who've never heard of Wedgwood, which is quite interesting. So, one of the other problems we've had was one that I've referred to, and that was that we had intermarriage, because the next generation of Wedgwoods and Darwins intermarried as well. And there were an awful lot of health issues. And if you think about the number of people in society in those days, it was very easy to keep money in families. And some of those infant deaths would have been due to congenital abnormalities and some weird syndromes. One of the good things was that there was a gradual move towards the improvement of treatments, in as much as some medicines were discovered. There was a lot of work done on foxgloves, which are highly toxic. Do not do anything at home with foxgloves, please. William Osler, who was a physician, a Victorian physician, came out with this lovely truism, really. The person who takes medicine must recover twice, once from the disease and once from the medicine. And Erasmus Darwin was part of a Lunar Society group, great thinkers, inventors, but some of them were involved with medicine. And there was Dr. Withering, who'd done a lot of work on foxgloves, as had Erasmus Darwin's son, Charles, who sadly died as a medical student up at Edinburgh University. Dissections without rubber gloves on unpreserved bodies was not a very healthy thing to do. And young Charles Darwin had written a thesis on the substance that you would get from foxgloves, digitalis, and Withering had done a lot of work. And in his grief, Charles Darwin sort of appropriated a bit of Withering's work, and so there was a big falling out. Withering had said that this drug was the safest drug that they had. No, it wasn't. And unfortunately, the only way of working out dosage was trial and error. And unfortunately, both Withering and Erasmus Darwin admitted that they had killed people. But that was sort of, in those times, par for the course. So, if we move on, we have here a lovely satirical cartoon, and it's a butcher threatening a doctor for poisoning his wife. And this is John Bull, and that, the scrawny one, is a doctor, because so many doctors were said to be poisoning people. So I quite like that one. But sometimes this research that they did, this trial and error, worked. And John Parkinson, the son of James Parkinson, who first described Parkinson's disease, wrote a paper on the successful treatment of trismus in 1811. Now, trismus isn't a word we use, but I suspect most of you are familiar with the term lockjaw. Yeah. So this 50-year-old lady had been infected with Clostridium tetani, and it results, the spore causes a neurotoxin to actually paralyse part of the body, which is why we get the lockjaw. And if people can't move their jaws, they can't drink. And people used to die from dehydration. So what James Parkinson did was he drip-fed this lady laudanum every hour for several hours, and it managed to overcome the effects of the neurotoxin. All well and good. The other part of his paper describes the other part of his treatment, which will be no surprise. It was lots of enemas and lots of things to make her sick, but surprisingly, this lady survived with no ill effects. So things sometimes were moving forward. And just in case you want to know one of the definitions of the elderly, because tetanus has a 40% death rate amongst the elderly in this country, so you need to be careful. If you were born before routine immunisations against tetanus in 1961, join my club. We elderly, onwards and upwards. Now, one of the awful things was this lady. Anybody who came to my talk on prostitution will know that this lady in the corner is Moll Hackabout over here. And she is dying from sexually transmitted disease, which would actually have been syphilis. And this reminds me very much of A Christmas Carol, because we've got people here, she's dying and they're going through her goods. The doctors are arguing about her treatment, and there are pills and ads for pills on the floor. Nothing will save this lady. They cannot save her. But, as Hilaire Belloc said, physicians of the utmost fame were called at once, and when they came, they answered as they took their fees, there is no cure for this disease. And sadly, for syphilis, there was absolutely no cure until 1906, when we had Salvarsan, which was a really horrible treatment over many, many months. And then we moved on to penicillin in 1943, which actually solved the problem. So this lady is by a fire, and they are perhaps vaporizing mercury, because that's what they thought would cure syphilis. And on the idea of getting rid of things out of the body that were doing you harm, they used to give mercury because it produced lots of saliva. In fact, it was known as the salivation treatment, and saliva was often measured in quarts, which is one hell of a big quantity. Please explain a quart later on. Nobody knows. Probably knows what a quart is. If you were treated with mercury, it could affect your nervous system, it could affect your mental health, it could make you blind, your teeth would drop out. There were an awful lot of very serious consequences. You were probably better just going with the syphilis and perhaps dying later on down the line. But of course, the doctors would not have got their fees. Now, this lovely little book, which please come and have a look at it later. Lavender, water and snail syrup. Who could resist? There's a lovely story that Nicola Lilly inherited a trunk. And when she looked through it, there were pieces of paper that contained recipes, receipts for household remedies. And she decided that she would put her ancestress's recipes together, and Miss Ambler's receipts were published. Do not try these at home. And just to give you a flavour, I'm going to actually read some of them. Elizabeth Briscoe, nee Ambler, was born in 1712. Some of them were preventative, some were curative. Now, Dr. Mead reckoned he'd got a cure for the bite of a mad dog. Today, the people surviving rabies would be less than 1%. He reckoned he'd save 500 patients plus in 30 years. He was a royal physician. He'd written a very good paper on poisons, but I don't think this cure would be effective. It relies on mixing lichin, black pepper and milk, and then for a month you have to take a river dip. Now, you go in the river water, but you must not let your head be immersed in the water, and you have to stay 1 minute. So that's going to be difficult, climbing in and out to even do that. After the month, please God you're not bitten in January, after the month there is a fortnight in which there are 6 immersions, and that apparently was enough. So why are we letting so many people die these days? Then we had Walter Raleigh's Receipt Against the Plague, which was just a mixture of alcohol, herbs and treacle, which I don't think that would work either. Mrs. Shanks, if you're feeling under par, she had an invigorating little tonic. I wonder how many of you would be interested in this. Take 1 small chicken, boil it for 6 minutes in a quart of water. Then you put in the viper and you boil it for 4 minutes. Then you are allowed to strain it and you drink a quarter of a pint 3 times a day. No refrigeration, remember, so you've got going off viper water. Wonderful. Now, some of you may be familiar with the term patient compliance. And patient compliance is like the spoonful of sugar that helps the medicine go down. Those little pill containers that tell us on which days we should take our medicines. It's things to try and make us take the medicine. Mr. Wardle, I think I might have stuck with this one. Now this was for gout and for colic in the stomach, because all of these remedies amazingly covered lots of different things. Now, first of all, 2.5 pounds of raisins chopped, 1/2 pound of rhubarb, shred very thin, from Yorkshire of course, 2 ounces of senna, 1 ounce coriander seeds, 1 ounce fennel seeds, homegrown, 1 ounce cochineal, Mexico, beetles, 1/2 ounce of saffron, saffron Walden, and 1/2 ounce of licorice, Pontefract. And the senna would have come from Arabia. So what do you do with all this? Well, you put it in 2 gallons of best, no cheating, best branding, and you let it stand for 10 days in a large bottle. Sometimes stir it, then strain it off and put in 5 quarts of brandy. Let it remain for a month or 6 weeks, and then you're ready to go. If the pain is troublesome, take a wine glass. Remember, their glasses were small. Take a wine glass. And if the pain is not better after 2 hours, repeat. So I think that is a far more successful remedy than perhaps your viper soup. Because I don't know about you lot down here, but in the north we're a bit short of vipers in Waitrose. So, hey ho. And here, of course, is a lovely satirical cartoon about gout. And gout is often portrayed as pain in the big toe joint, but it can actually be pain elsewhere in the body, and it's because of a build-up of uric acid. And the Georgians, the wealthy Georgians, were very, very big meat eaters, and that is one of the risk factors. Superstition played a part in medicine. Samuel Johnson, every day of his life, he wore a little talisman token that had been given to him by Queen Anne when he was touched by her, because it was thought that he had TB lymph nodes, he had swathula. It didn't cure him, but we have the wound. Now, the medical men at this time were divided into surgeons, physicians, and apothecaries. Now, the most important were deemed to be the physicians. The apothecaries were down the bottom. But the surgeons were gathering pace with the increase in knowledge. But to get this increase in knowledge, as I have suggested, they needed to do dissections. And so surgeons' assistants used to go and try and get bodies for them. Now, before the Murder Act of 1752, they used to just go out and at any execution would have an argy-bargy with the family and try and get a body off the scaffold. First come, first served. Quick grab and run. Needless to say, the families were not happy with this situation. And there was a shortage of bodies that had existed for a long, long time. The government decided, because people then started to dig up graves, that they would introduce the Murder Act. And that meant that anybody who was executed for murder, their body would then be hung in chains, or, more likely, it would go for dissection. And so these people were not allowed to be buried, which was the norm. So it was also an extra punishment for people who had religious convictions, because a lot of people thought that if you didn't have all of your body together, you could not enter the kingdom of heaven on the day of judgment. And it was said that people wept when it was said that they would be dissected because they feared for their eternal life. If anybody is thinking of donating their body to medical science, this does not happen today. It is very, very strictly controlled, and it's very respectfully done as well. The Royal College of Surgeons has about 100 bodies donated to it each year, for example, and there is a service for the family and the Royal College members each year to give thanks for those donations. Here, we see the dog eating body parts. We see people not really paying attention. We see lots of people doing lots of different things at the same time. Here, we see that body parts are being boiled because the skeletons could then be preserved, and those were used for teaching purposes as well. And so, in my Murder Most Foul talk, we talk about people whose skeletons are still held in various museums around the country. Erasmus Darwin House did actually have a dissection. Now, can you imagine Dr. Darwin saying to his wife, "I've just got a body. I'm going to bring it home and we can dissect it." October the 23rd, 1762, the body of a malefactor who is ordered to be executed at Lichfield on the 25th inst. Will shortly afterwards be conveyed to the house of Dr. Darwin, who will begin a course of anatomical lectures at 4 o'clock on a Tuesday evening and continue them every day so long as the body can be preserved. Now, my husband was a doctor, and if he'd have done that in Lichfield, he wouldn't have been my husband for very much longer. This was open to anybody who professed medicine or surgery or love of science. So it was a free-for-all. Anybody could actually attend. And the chap who was dissected somewhere in Erasmus Darwin House was somebody who tried to leave the army, and when they managed to come across him, there was a bit of a fight and he stabbed somebody. So that was the end of Thomas Williams. We don't know which room if ever you get to visit the museum. Anybody know the name Anne Lister? Yeah? Anne Lister, probably through the television programme Gentleman Jack. Fascinating lady. She wrote 24 journals. Most of them were in code. They took years to actually work out what she'd said. Now we know her because of Gentleman Jack, perhaps because of her sexuality. But she was a fascinating lady who was one of these who professed an interest in science. So she took herself off to France. And in France, she engaged a professor to teach her dissection. She had no medical training, and she slated the professor who tried to teach her because she said it wasn't very good. She could have done it a lot better. And she then had a garret that she hired, and she had body parts delivered to her, and she used to go and view a lot of post-mortems and dissections. So things were somewhat different in the 18th century. One of the big killers in the 18th century, of course, was smallpox. We have the great pox and we have the smallpox. And you'll be very pleased to know, because they're very gruesome, I'm not going to show any pictures of smallpox. You can go on the website of Wikipedia, for example, will show you some pictures, and it's known as the speckled monster. It was a very disfiguring disease if it didn't kill you, and mortality was about 30%. Lots of famous people died over centuries of smallpox, but the 18th century saw a great increase and then a great fall in smallpox. So you had Queen Mary of William and Mary, she died at 32. Pocahontas, a century earlier, she died of smallpox. Rich, poor, it affected everybody. Erasmus Darwin had smallpox, survived, disfigured, not in his pictures. Lady Mary Wortley Montagu. She was the wife of the Turkish ambassador, and when in Turkey, she noticed that every autumn people were scratched with mild smallpox, and then they didn't seem to die of smallpox. And she was intrigued by this, brought it back, and this system, which in this country was called variolation, was carried on for decades. And it was very popular with employers because they were losing so many employees to smallpox. Variolation was the idea that you introduce a weak, you only did it if somebody had a mild case of smallpox, you scratched them, a little scratch. It came to the UK, in England I should say, it was tried in the royal court. This lady was a friend of the Princess of Wales, who later became Caroline of Ansbach, wife of George II. So that was Queen Caroline. They undertook an experiment. They had 6 prisoners who were condemned to death, and they made them an offer they couldn't really refuse. Would you like to take part in this experiment, or would you like to be hanged? And strangely enough, all 6 went for the experiment because they were told, if they survived, off you go. All 6 had the scratch with smallpox matter, all 6 survived, off they went. Slightly less ethical was perhaps taking 6 orphans and doing exactly the same. But fortunately, they all survived as well. The Queen introduced it to the court, and we all know that anything that happens in court becomes popular, and so this system of variolation became popular. Unfortunately, the doctors came in, and as I'm speaking, I want you to be thinking, good, bad, deadly, and I'm sure you've worked an awful lot out yourselves. And so the doctors made a little bit of a difference to how it was done from how it was done in Turkey. One scratch in Turkey. In England, Queen Charlotte, wife of George III, describes the heroism of her children, who had 2 holes cut in their arms, and a thread dipped in smallpox matter was pulled backwards and forwards. They also had a regime where you sometimes stayed with your doctor. Surprise, surprise, you had purging with calomel beforehand, and you had to have it afterwards, and you restricted what foods you ate at the time. So Turkey, quick scratch, goodbye. England, ching ching, and did a lot of things. It was very poignant that Queen Charlotte wrote that she was very fortunate that only one of her children had died of variolation that had a 3% mortality rate, and the following year another child had the same problem. But we don't know whether or not those children actually had smallpox before they had the variolation. It was so popular though, that did not affect variolation figures. And then we come to the big success story of the 18th century. Oh, and by the way, if anybody ever goes to Lichfield, there is a plaque because of the work that she did preventing so many people dying of smallpox in the cathedral. You go through the west door, west entrance, and it's up there, tucked round the corner, where it's really difficult to get a good photo, so none of mine have been good enough to put, so my apologies. But if ever you're there, you can crane your necks and have a good look. We had this gentleman. This gentleman had noticed that milkmaids who had cowpox, which is related to smallpox but nowhere near as dangerous, did not die of smallpox when there were mini outbursts, outbreaks of smallpox. When there was an outbreak of smallpox in his area, he got his children and his wife to a farm where there was an outbreak of cowpox, and he directly took matter from a cow and scratched his children and his wife with it. They did not die of smallpox. So he was very happy with the outcome. However, his life was ruined because people thought he was engaging in bestiality because he had taken matter from a cow and put it into his children. He was doing the devil's work. So Benjamin Jesty, Norfolk farmer, is not known as the father of immunisation. We have to leave that to Dr. Jenner. So what is the difference? Well, yet again we have a few ethical issues here, because Dr. Jenner decided to do an experiment and he used his gardener's son. So I think there might have been a little bit of pressure there. As you can see, James Phipps, 8, well he wasn't going to be given consent, was he? And this happened in 1796. What is so sad is that the Royal Society had received information about this link way back in 1760. So that's one heck of a long years. No, 1740. So that's an awful lot of years for somebody to take this up and do proper research. And it was because he did proper research that he is known as the father of immunisation. So what happened? Well, this lady, we don't know what her face looks like, but her hand is retained for posterity. This is Sarah Nelms, and she was a milkmaid, and she was suffering from cowpox, and here you can see the cowpox blisters. They don't look very nice, but these heal up unlike the smallpox, and it looks nothing like smallpox as well if you go online and look at smallpox. Excuse me. So this is the process. So as you see, we've got our lovely milkmaid here, and she's got all these blue spots, which shows that she has cowpox. And in case you're interested, the cow with cowpox is Blossom. So Sarah Nelms, James Phipps, then gets some cowpox matter scratched into him. He falls ill with a mild case of cowpox, from which he recovers. Then we have a patient, this wasn't Sarah, obviously, because milkmaids with cowpox didn't get smallpox. They got somebody who had smallpox and they scratched some of the matter into James. And what happened to James? Unaffected, he was protected. And then they had evidence for the first time of the link that had been proved. Jenner went on to practice this on his own son. He worked on it for years. It was 1796 when this first happened, and it went on so that a lot of people's lives possibly were saved. And we don't know because we think there might also have been a natural decline of smallpox. So we can't say 100%. Medicine is always complicated. But there was a lot of opposition to vaccination, vacca from a cow. And in this cartoon, you can see how children are being fed into this awful cow, this vacca. And when they come out at the other end, and I have a laminate, you can look at it more closely, they've all got horns on because they've been affected by a cow. And this one you probably know. You can see here that here is Jenna. This poor woman is having the vaccination. And if you look all round, all these people have had vaccinations. We've got a woman with a cow coming out of her mouth, a chap with a cow in his arm. They're all showing cows in different places. Surprisingly, a lot of the people who were against vaccination were doctors because it was very straightforward and very simple, and they built up this big mystique about variolation. So we now have the old-fashioned doctors in the wigs, the heavy wigs, and then we have the new medical men, and we have the cherub, and we have the laurel being placed on Jenna's head. It was only in Victoria's time, in 1840, that variolation was banned. Vaccination against smallpox actually became obligatory under the 1853 Act for all infants. And then there was a catch-up period in 1867. So all 14-year-olds and under who hadn't had this treatment, it wasn't a jab, we didn't have syringes, this is what happened to them. Routine compulsory vaccination ended when? 1948. But you will know people who had smallpox vaccination and they will have like a banana mark on their arms. And that's because we had outbreaks of smallpox after that day. The last case of smallpox in this country was where? It was in Birmingham, and it was an accident. Somehow, some smallpox that was being worked on escaped, and a photographer died. A young woman died because she got smallpox. The last case wasn't that young girl, it was actually her mother, but the mother survived. But the tragedy was also added to because the professor in charge of the unit committed suicide. So it was a very, very sad state of affairs. Variolation, 3% death rate. Vaccination, very, very safe. Erasmus Darwin wrote to his son, that he hoped, and to Jenna as well, just before his death, he said, "You have done one of the greatest things that anybody could do for our nation." He said, "I am hoping that in the future, every child on their christening day will also be vaccinated against smallpox." And because so many children were christened, that effectively did happen when the Victorians made it compulsory. So, ladies and gentlemen, would you have liked to have visited a doctor? Would it have been good? Would it have been bad? Or would it have been deadly? I leave it for you to decide. Thank you for listening, and any questions?
Sorry, two questions. First of all, the chap you were talking about right at the beginning, that they tried to revive. Now, if they were managing to take blood from him, I would have thought that the heart must have been beating if blood was actually coming out of the arm.
He probably still was just about alive. Yes, I think so. And perhaps they made such a big hole, they probably stamped him so much. Did you hear the question?
No.
The question was, when we were talking about the failed resuscitation at the beginning, how do you get blood out of somebody whose circulation isn't working? So I was saying his circulation must have just about been hanging on. And also, I suspect that they weren't very gentle like a needle is today. I think there might have been, because they had special lancets. These were like scalpels going in. So this wasn't like a little pin prick and you hope that the blood comes out sort of thing. So it was, I agree. He must still have been alive at that stage. And your second question?
It was about the children being vaccinated on their christening day. Wouldn't that be a little bit young? I mean, babies you have to be very careful with babies when they're tiny, because their immune system isn't really up and working properly. I don't know.
When we are born, we are a clean slate as regards immunity. Within hours, we are faced with hundreds and hundreds and hundreds of organisms. And it is amazing how many we fight off. When you look at what it must be like in utero and outside, it's amazing that we survive. Our immune system is fantastic when we're babies. And yes, we do immunise a lot of children very early on, it seems. But they wouldn't have had medical research for that. So they would actually just have been, he was saying, let's make it routine. Let's make it part of everyday life. And he did say to his son, by the way, don't do it, variolation, this was earlier on, don't do it unless there's an outbreak because it carries a risk. So that was a good thing that they were starting to realise, that we should be doing risk analysis. That some of our lives are worth it. Any more questions?
I'd just like to add something about the babies, is the fact that actually as we become more clean, actually babies are more in danger in a way, because we're sanitising everything, and the chances of the microbiome being created, which is a healthy thing. And even from the way babies born, if babies born by cesarean, then they don't get the same, they don't get it.
Yes.
There's so many things that
Yes.
don't start to
Yes.
get.
Yes.
So the cleaner we are actually is more.
It does cause problems. They have looked at children who go to nursery and children who don't go to nursery. And children who go to nursery, their immune systems are triggered. Although if you've got a small child in your family, you would probably think their immune system isn't working very well, because you're always covered in snot, grot and everything else. But no, yes, these days perhaps we are too clean when you look at what children used to have to put up with in the past. And that has been a big concern, particularly with certain diseases such as asthma. And the nursery one, somebody did some research which showed that children were less likely to get leukemia if they actually went to, in very early childhood, if they went to a nursery, which also you can say if they mixed with other children, whereas in the past they wouldn't have done. So
So I think it's like hand sanitizer, that was a thing. I mean, that was a thing. When I was a child, that wasn't a thing. No, it was a thing in hospitals, but it wasn't a thing that you could buy. And now it's like everywhere. So it's
As a grandmother, it's been my duty to make sure that my grandchildren's immune system is fully up and working.
yes, my children's were perfect.
They survived our house, they survived it.
That was ours, domestic non-goddess, yes, very much so. And my husband was a GP, and before we had our firstborn, he said, when I get home, I'm going to change, I'm going to wash, I'm going to do this, I'm going to do that, and he never did it. Now, he had only a few days off in all of his medical career, and that was because of trauma, like if you fall out of a wheelie bin, because you're compressing rubbish. That's nothing to do with your immune system. So if you're hit by a hockey ball or a hockey stick, likewise. So you see, he was extremely healthy, and I'm hoping that some of those bugs, because our children were extremely healthy as well, we were very, very blessed.
Can I ask? One of my ancestors, I think it might have been in the newspaper, 1795, and it's put there that he was walking in Hyde Park and he died from apoplexy. And I'm just wondering what apoplexy was.
What was apoplexy? Apoplexy was thought to be a stroke.
Right.
That is the general understanding. However, death certificates and the like weren't very accurate then, so people would put stuff down. One of my murder talks, for example, one of the ladies was very vulnerable and went to see somebody who killed her because the doctor had said she'd got a raised heartbeat because somebody put a spell on her. Now that was in the middle of the 1700s, so you can see how even then we've got this superstition and other things going on. So it wasn't as scientific as it is today, but that's generally what it was thought to be. There's a gentleman at the back.
Thinking back to the 18th century, how were doctors trained? Was it an apprenticeship model or?
It was an apprenticeship model, but it wasn't a model that we'd like to see replicated today. Basically, you went to university and you studied the Greek and the Roman way of doing things. Now, to be fair, if you think about a lot of medicine, it is to do with imbalance. And we know that cancer starts when our cells are going out of control. So part of it is right, but a lot of it was very wrong. And unfortunately, this persisted for a couple of, from the Greeks right through 17th century, 18th century waning, 19th century altered completely. And we used to have schools of anatomy. Now, they weren't attached to medical schools. So people used to turn up, like we saw in that one slide, the dissection. They would just go for some dissections. We did not have the medical schools where anatomy was taught. And one thing I forgot to say in the lecture, which I think is very important that you go away with, is that if you want to see Blossom, her hide is in St George's Medical School. That's sweet.
St George is here.
Tooting. Yeah, Tooting. So the medical training after that was that you attached yourself if you've got money and if you're allowed, and you followed round the hospital doctors. Or you learnt by example, or you just set up by yourself. Erasmus Darwin didn't follow a general practitioner and learn about being a family doctor. He had gone to Edinburgh. He'd followed the Greek and the Latin route. He'd attended some lectures, some of which we now know were a load of rubbish. So, the training was far from satisfactory. There was a question over there. Sorry?
I was just thinking about the first example you gave of the guy, the Earl or whatever he
The
was.
resuscitation.
It probably sounds like he'd had a cardiac arrest.
Yes.
When did CPR, as we know it today, become?
I don't know the answer to that.
It just occurs to me. I wonder how long people have known how to do that.
I don't know.
Listerine.
But that's going to be a question I'm going to have to find the answer to, isn't it? That's going to be yet another warren hole I go down. I don't know, but that's an interesting one.
Sorry, you mentioned the medicine that children were given, or people were given. I seem to remember it was Dr. Collis Brown. I think that had either opium or cocaine in it until, I think, the 50s.
That wouldn't surprise me. Gripe water, for example, it was illegal to give children gripe water. It's illegal to give children alcohol under the age of 5. And what did gripe water have in it? Alcohol. And in fact, there were legal challenges to some people who were travelling around the country. They were banned from pharmacies because they were buying up vast quantities of gripe water. And so people actually had restrictions put on the pharmacies they went to. So there we go. I think perhaps we ought to bring it to a close. I'm so sorry if we've overrun.